Welcome back to the Annie Frey Show. Fraud is all over the place. We know J.D. Vance has been tasked with rooting it out at every nook and cranny and corner that he possibly can. We've had Dr. Oz on this show maybe 6 weeks ago, maybe a couple months ago, to talk to us about how hospice programs, Medicaid, all of these different ways that people are being taken advantage by folks who know the process, taking advantage of Americans and stealing taxpayer dollars for Lord knows what. Well, there's one person who's been at the lead of trying to root this out in Ohio, and it's Luke Rosiak, who's with us once again. Investigative reporter at the Daily Wire. He's got an investigative series, Medicaid Millions. Luke, welcome back to the show. It's good to have you here with us once again.
Thanks for having me, Annie.
So I want to know just kind of your personal arc in investigating this, because we've talked to some people who are doing some similar to what you're doing in other states, and it's always frustrating to me how early and how long somebody like you's probably been investigating this or had your eyebrow raised to it. You've been looking into it, and fortunately now it's a national story. It's got the administration's attention. How long have you been noticing that Ohio has a big problem when it comes to Medicaid fraud?
Well, the stuff that we all heard about in Minnesota from people like Nick Shirley, a lot of it had to do with Medicaid waivers. And so I think that the problem is Medicaid, a huge portion of it is actually fraud. And the states have different waivers that allow you to add on these extra programs. And so I looked at nationally, I used a database to identify the hotspots, and a number of things popped up. And one of them was Columbus, which turned out to be the second biggest Somali settlement in the United States. So that was an interesting commonality there with Minnesota. But there are other states too. Interestingly enough, Missouri is up there for the states that use this home care waiver that allows you to get paid to take care of your family members. And it turns out that it's just one of these programs. It's kind of like the mail-in votes of medical services. It's inherently hard to it's easy to defraud, and it's hard to prove that it is fraud because we're talking about stuff that happens in the privacy of somebody's home.
Yeah, let's talk specifically about what this looks like, especially since you highlighted that it exists here in Missouri, the same kind of setup. I would imagine there are people who are rightfully staying home, maybe giving up their job or their income to take care of a loved one, and that there would be an appropriate application of a program like this. Is that accurate?
Well, originally the idea was that if there are people that are so sick that they would otherwise be in a nursing home, it would be cheaper to pay somebody a couple hours a day or a couple hours a week to come check on them or bring them food. So mathematically, that makes sense. Nursing homes are very expensive. The problem is that people started claiming to be sick in order to get paychecks for their family members, to the point where there's just an explosion of people claiming to be ill who never would have claimed to be so sick if they actually had to go move into a nursing home. So, of course, this program was conceived for a reason that had a purpose originally, but it's gone on off the rails a long time ago, to the point where the people that need it, they may be the exception rather than the rule.
Yeah, I think that's such an important part of this story, is the fraudulent claims that predicate any sort of actual care and concern for any individuals, that there are people who are just from the top to the bottom lying about what they're doing and making money off of it. How much money in Ohio do you assess, or do you assume is being found in fraud based on this type of process?
Well, if you just look at how much is actually spent on home care itself, not fraud, just how much is spent on the program, it's over $1 billion a year. It's one of the largest Medicaid programs, more than like going to the doctor and getting an X-ray or things like that. So it's huge. And some of these people are taking care of their family members. They really are providing some care, but a lot of those already would be doing it. Like if your mom is getting to be up there in years and you go and you clean her house once a week, you're not going to not do that because you didn't get a government paycheck. So in some cases it's real, but they'd be doing it anyway. And so I talked to a guy that worked at a home health care firm in Missouri, and their business model was calling around and saying, are you living with your aging mother? Are you already helping her? Well, why don't you get paid for doing something you're already doing? And we're going to keep half the money and we'll give the other half to you, but it's a little cash in your pocket that you wouldn't have had anyway. So, yeah, it's quite a large amount of money. And in Ohio, like the Medicaid is the largest expense in the state's budget, and it's doubled over the last 10 years, even though enrollment has remained flat. So it's like, what is going on here? The costs, we just can't keep doing the status quo because something has changed over the last 10 years. And it could be that a lot of it is what I've seen is foreigners. I'd say the overwhelming majority of people doing home health care in Columbus, Ohio, are not actually Americans. They're Somalis and they're Bhutanese. And it turns out that they claim to need this service where when it was just Americans in America, they wouldn't tend to claim like, oh, I'm dying in my bed. I can't even get up to move. I'd be in a nursing home. It's super bad. And they're probably telling the truth. It turns out that Somalis just learn to say that, and they'll all say it, even though they're just like 65 and they're basically perfectly healthy.
Luke Rosiak speaking with us right now, investigative reporter at the Daily Wire. You've mentioned this. We've heard this from other investigative reporters in Minnesota, and it's like this. It's part of this Somali culture that this is just kind of something that if you're not directly participating in it, it'd be really pretty hard to not know that it's going on. Is that an accurate statement?
Yeah, and I think it sets it up for these conspiracies, basically, where you have doctors involved, you have the companies, and you have the old ladies, and a ton of people know what's going on, and nobody is going to tell the police. And interestingly enough, the Bhutanese community, people from Bhutan, there's a group of refugees, and it's not actually most Bhutanese people. Bhutanese people are Asian, and a lot of them are good people, but there's a subset within them, a subculture that is refugees or supposedly refugees, and they've landed in Ohio. And 81% of Bhutanese people are on welfare in the United States. And the other 19% own these companies, or a large portion of the remainder seem to own these companies. And so one of the differences here when we're talking about this home health care stuff is you're not just receiving welfare from the government, or you're not receiving a medical service. You're able to direct the payment on your behalf to a company that you choose. And so it becomes way more lucrative because it's not that these people actually want people to come, go around their house and like clean or whatever. They want to direct the payment of government dollars to their friend or their neighbor or their family member. And so, I had a story where this Bhutanese guy, he's drinking champagne on private jets while wearing Prada because he owns a private yacht and a private jet. And he puts all these photos of himself online to the point where he's regarded as a celebrity in Bhutan. His name is Roshan Adhikari. And when you look at just the people with that last name of Adhikari in Ohio, they've gotten $350 million from Medicaid and for adult daycare centers. And so that's just one clan from one country within one state. And it's a tenth of the GDP of Bhutan. And so it's not just this one guy. Like there's a bunch of people that are from the same country doing the same thing. And they have these charities that share addresses with the Medicaid companies that then send the money to Bhutan. And so what this is it is a conspiracy where all the Bhutanese people are bilking Medicaid by pretending to be sick as a systematic way to send foreign aid to their country in Asia.
Man. My jaw dropped when you told that 350 million detail of that story. Luke Rosiak speaking with us right now, investigative reporter at the Daily Wire. Luke, this sounds like a drug ring. It sounds like an apparatus where there is a structure that is understood and that you get a lot of people involved and nobody wants to cause, the whole thing to come crumbling down because it would catch up so many different people in it. Is there an obvious structure? You just mentioned one person who kind of maybe sits at the top of that while he's sipping champagne in his private jets. In Ohio or in other areas where you've investigated, is there kind of a pyramid to how this fraud gets managed?
There's definitely a pyramid. I mean, they put companies in other people's names and they accumulate vast wealth. And there are people that own, 10 houses or more because there are these Medicaid magnates. And that's something that I'm going to report on more as our stories continue to roll out. But yeah, another way I look at it is the pyramid with doctors at the top. And so in the past, basically the doctors are able to authorize tens of millions or hundreds of millions of dollars in government spending. And they don't even work for the government. So in the past, obviously the way it's supposed to work is Congress has the power of the purse and they're going to deliberate and appropriate money to a specific agency. But there are doctors that are basically corrupt and they don't really care. It doesn't cost them anything if they just say that everybody is really sick. And so they'll sign this paperwork. And so I think that's a way that Congress needs to change the rules. rules and maybe even bring it in-house where only government doctors can sign off to say that somebody has a severe disability, because it's a really weird thing where these are private doctors and you can just doctor shop until you find one who doesn't care. And CBS had a great story involving hospice, where one doctor had authorized the expenditure of $72 million in federal funds for people that he said needed hospice, and most of them didn't actually seem to need hospice.
See, and Luke, this is we talk a lot of politics here. It's like a political news talk show, but we talk a lot of culture as well. And it would be satisfying enough to me to know that we've rooted out this fraud and we've stopped it in its tracks, and that people are going to pay for what they've done. But I'm assuming that the victim here isn't just the American taxpayer, that there are people who are probably seeking out Medicaid, people who are probably seeking out hospice care, that need this type of care, families who want to care for their loved ones, that the victims here, it's not just a political, this is a bad thing, we need to find the fraud and end it, that there are actual real live people involved in being victimized here.
Well, sure. In Ohio, they've changed the House and Senate passed Medicaid reform to some extent after my investigation, but they walked back some of the reforms after people came to them saying just that they really need these services, and it would be very sad if they went away. But at the same time, by definition, the kind of person that calls up their legislator and complains about the process and says, I went through a lot of red tape and it was difficult, those aren't the fraudsters. The fraudsters don't encounter any of that red tape because they control the whole process. They've got doctors, they've got companies, everybody's in on it. And so Ohio at this point implemented, GPS tracking, which is a good first step. There's ways around that too, but, when you order Uber, when you order like DoorDash, they're tracking your sandwich with a GPS. So certainly we need to be tracking the people that are getting paid $90,000 a year to go to different old ladies' houses and sweep the floor. We need to make sure they're actually going there. But there are people that were upset that there was a crackdown that could impact the way that these services were provided to them. But I think it is a side effect of mass immigration. We have these, and people like J.D. Vance and Andrew Ferguson and Dr. Oz have all talked about this, that we brought in people from a low-trust society that will scam anytime they can scam. And most of our programs that seem to work reasonably well for the last however many decades, they're predicated on people being generally honest. There really wasn't any fraud, any way to stop the fraud. It's just if you were willing to lie, you would probably get the money. And we don't live in that world anymore. And so for the disability activists who are concerned that this may make things harder for them, I think that's exactly right. I mean, that is a cost of bringing in massive amounts of people from the third world. And we need to be realistic that money isn't finite. And when you look at the budget of Medicaid doubling in Ohio over the last 10 years when enrollment is flat, that's not sustainable. Something has to change. And so I think that the people that are concerned that it may impact them, and they're right, money's going to dry up, and the people to take this up with are the Somali and the Bhutanese fraudsters who are flying on private jets and earning hundreds of millions of dollars.
Well, I will say that Ohio certainly, but the country is fortunate to have you as an investigative reporter on this story to expose it. My final question to you, we're speaking with Luke Rosiak, is do you believe that we are on the track to stop this fraud and to recover from what has been perpetrated here for I don't know how long?
I think that the fraud task force is really exciting. They've done a number of things in Ohio, cracking down. But I think that you can pursue individual fraudsters and put those people in prison, and you should, and that will create a deterrent effect. But I do think that the programs also need to be fundamentally changed. So you're not just paying the money and then chasing it later, but you're making sure the money isn't going out the door to begin with for somebody that isn't confirmed to have been really like an amputee or somebody with ALS or some very serious condition where we can confirm medically that they literally can't even walk. Because this is like $90,000 a year. It can be more if you get like 24 hours a day of care. This is a ton of money. And remember, we're only talking about Medicaid. So we're talking about people that didn't really pay taxes to begin with, and now we're paying $90,000, $180,000 a year to have people cook and clean for them. We may need to reevaluate how that program itself is done.
Yeah, so much so. Luke, thank you for being on the case, and thank you for being on the show with us today. We continue to follow your work and follow up with you. Thanks for your time today.
Thanks, Amy.
Take care. Bye-bye. Luke Rosiak, investigative reporter at the Daily Wire. His investigative series, Medicaid Millions, I would encourage you to look into it because it's pretty incredible.